Ooh, I love music. When I'm looking at medical records, I generally have like soft music playing, no words, just to kind of like be background noise, but not too loud, right? So like very low, kind of puts me in the zone. Well, speaking of zones, we are back with part 3 of week 6 for your introduction to CPT, HIPPICS coding. I'm Dr. Lisa L. Campbell, as you know, and we're going to dig into nervous system. Don't get nervous, but this one is a little longer. And we start off with the usual, right? Anatomy, abbreviations, guidelines, common procedures. Yes, I'm going to say it. Don't forget to bubble and highlight your manual. All right, so the nervous system is comprised of the brain, the spinal cord, and the peripheral nervous system, or peripheral nerves, I should say. And let's see what else I want you to know. In the CPT manual, you're going to find that procedures are going to be completed on those structures, so brain, spinal cord, peripheral nerves. But then also, you're going to see like the skull, the meninges, the extracranial nerves, the autonomic nervous system as well. And, I meant to mention this previously, but did you notice how at the beginning of each chapter they kind of remind you about the NCCI? And I think that's so important because when you take your national exam, that's something that you're supposed to know. And it's nice that it's called out a lot. All right. So the nervous system is divided into two systems: the central nervous system, which has the brain and spinal cord, and then the peripheral nervous system, which comprises the nerves that connect the body organs to the central nervous system. And the peripheral nervous system, and that probably was on a previous slide. I probably was going too fast. The peripheral nervous system is divided into two systems: the somatic and the autonomic. So the somatic are what connect the central nervous system to the skin and skeletal muscles via the cranial and spinal nerves. Then the autonomic nervous system connects the central nervous system to the visceral organs via the cranial and spinal nerves. All right, so I was moving too fast. All right, some additional anatomy to be aware of: the brain. The brain has more than 1 billion neurons that are connected by means of electrochemical pulses and is responsible for all physical and mental functions of the body. The protective tissue that covers the brain and the spinal cord, it is called the meninges. And the meninges are divided into three parts. There was a cartoon or something that went over these, but the three parts of the meninges are the dura mater, the arachnoid matter, and the pia mater. So the outermost layer is the dura mater. The middle layer of the meninges is the arachnoid matter, and then the innermost layer is the pia mater. The brain is comprised of a bunch of areas that I'm not going to review for you, but they are the cerebral cortex, the cerebrum, the cerebellum. Notice the difference in the words. The diencephalon, the brainstem, and that's all we got time to say for today. All right, so the spinal cord. The spinal cord is a column of nervous tissue that runs within the vertebral canal of the vertebra. And the spinal cord's function is to conduct impulses to and from the brain and serve as a reflex center for the body. The spinal cord is surrounded by the meninges and the cerebral fluid. And when you see a cross section of this part of your body, The spinal cord reveals areas of both white and gray matter. So there is a diagram in the textbook. There are 31 pairs of spinal cords or spinal nerves that are located in the spinal area. And you'll notice that most spinal nerves are named for the corresponding vertebra. And so, something I want to um, just kind of throw out there as something to remember. There's a really cool picture in the book, but you know how you have the cervical, like the neck area, and then you have the thoracic, right? And then you have the lumbar, and then you have the two little snacks at the bottom. That's how they're organized. So you'll see them listed, and actually, there's a diagram in the book that gives you cervical, and there are the number of vertebrae there, then thoracic, lumbar, and then the two snacks at the bottom. The two snacks are the bones, the sacrum, and the coccygeum. All right, so the cranial nerves, so there's 31 spinal nerves. There are 12 cranial nerves, and the cranial nerves originate from under the brain. And the cranial nerves are named for the area or function that they serve, and they actually identify them as Roman numerals. So for me, that's kind of a way that I can remember which ones are which because of the Roman numerals. All right. Abbreviations. I know you're like, whoa, we got some this time. Yep. Here are a couple here, as well as others here. Now, keep in mind, this is a small list, not to be exhaustive, but just to show you what's available. All right. So, the procedures completed on the nervous system are divided into three areas: the skull, meninges, and brain, the spine and the spinal cord, and then extracranial nerves, peripheral nerves, and the autonomic nervous system. Then we have injection, drainage, and aspiration procedures. And here you're going to see things like subdural taps. You're going to see punctures of shunts for tubing, just to name a few. Ventricular punctures. Those are codes that you see over there. It should be noted that some codes are for infants only. Other procedures that you have: craniectomy and craniotomy, which you'll actually see kind of listed together. But a craniectomy is completed to remove a skull bone, while a craniotomy involves making an incision into the skull without removal of the brain. In this particular code family, the codes are going to be organized based upon the reason for the procedure. Skull base surgery, surgery of skull base. Now, one thing that you want to know here is that these are extensive procedures that typically involve more than one surgeon. And in the subsection notes for this procedures, you'll see that this procedure can have three components: the approach procedure, that is what is needed to get in there; the definitive procedure, that is what is done to treat the problem; and then repair or reconstruction. The CPT manual subsection notes also talks about if more than one physician provides more than one component, that we need to use a modifier 51 for that second procedure, and the one that's lesser valued. All right, endovascular therapy. Endovascular therapy is completed within the vascular system of the head or neck for a specific purpose, such as to control bleeding, um, destroy a tumor, achieve hemostasis to stop bleeding for an aneurysm, control blood flow during intracranial or extracranial procedures, or for other regions. These codes are differentiated by the type of endovascular therapy. So, if it's a balloon or balloon angioplasty, balloon dilation, and then some are further differentiated according to the number of vessels that are actually completed. Next up, we have surgery for aneurysm, arteriovenous malformation, or vascular disease. And in order to find these codes in the index, you can look up a couple of options: aneurysm repair, then carotid artery; aneurysm repair, then intracranial artery; arteriovenous malformation, then cranial repair; or vascular malformation, then cerebral repair. You will take note that the codes are separated by the tumor location and the complexity of accessing the tumor. So, complexity here is defined as simple or complex. Next up, we have a procedure called stereotaxis, which we have seen before. Here, we're talking about stereotactic procedures completed on the brain. And with these procedures, you'll see that they'll use some type of imaging, so CT, MRI, just for an example. Burr holes are then used to access the brain to insert a needle, electrodes, catheters, or probes. And these particular codes are differentiated by the procedure performed and the reason for the procedure. So at this point, you should really clearly see that documentation plays a huge role, and why we may need to use the query process we may need to use the query process, right, to get more information from the provider to assign the correct code. Stereotactic radiosurgery, these codes are reporting a procedure that uses externally generated ionizing radiation to eradicate specific targets in the head. Something to note: no surgical incision is needed. This is something that is generally reported by a neurosurgeon. And if an oncologist, a radiation oncologist, is involved, they would use codes from the radiology section. We haven't got there yet, but it does indicate that in the notes. All right, neurostimulators. So, neurostimulators, there are two types: simple and complex neurostimulators. These codes are differentiated by the approach. I hope you're seeing a trend: twist drill, burr hole, craniotomy or craniectomy, so forth and so on, and the actual type of neurostimulator placed. In this particular area, looking at the CPT codes, you are going to see that the codes are organized for insertion, replacement, revision, removal of neurostimulators. And what? There are guidelines, 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 guidelines. What can I say? There's guidelines everywhere, right? All right. So the next area of codes that we have are repairs. And repairs are completed on the skull and skull vault. Okay. And it's a whole list of stuff. And in order to find these procedures, you can go to craniotomy, then encephalocele repair, then encephalocele; cranioplasty, then encephalocele; cranioplasty, then defect; cranioplasty, then autograft; cranioplasty, then bone graft. Whew, that was a lot. All right, then we have neuroendoscopy. Endoscopy means to do what? Look within. And guess what? If you have a diagnostic and a surgical, the diagnostic is included in the surgical. These codes are differentiated based upon the reason for the neuroendoscopy, and it may include things like dissection of adhesions, fenestration of the spectrum, PELLUCIDUM. I can't remember how to say that. excision of a cyst, or excision of a tumor. Next up, we have cerebrospinal fluid shunt procedures, which involves shunts that are reported with code 62180 through 62258. And these shunts are placed to drain fluid away from the brain. In this particular code family, you also are going to see codes for replacement, irrigation, and taking out those shunts. All right, moving right along to the spine and spinal cord. Um, these codes begin at 62263. Now, before you even look at those codes, you need to read the extensive instructional notes that are at the beginning of this area. The codes themselves, it's a lot going on. Injection, drainage, aspiration, catheter implantation, reservoir pump implantation, endoscopic decompression. I mean, it's just a whole list of stuff going on. So the codes are based on the approach, but what you're going to notice that these procedures are not only on the brain, but also on the spine and spinal cord. So again, review the notes. Review the notes to make your life easier. All right, next up we have extracranial nerves, peripheral nerves, and autonomic nervous system. And here you have a range of codes that's subdivided into a bunch of stuff. So, introduction, injection of an anesthetic agent, nerve block. Of course, you have more neurostimulators. You have destruction by neurolytic agent. Let me just pause for a second. Notice how we said injection of anesthetic or steroids, nerve block, or destruction by neurolytic agent. So I guess my point is just pay attention to what is happening. And these codes are out of order. Now, when you are coding procedures that are completed on the nerves, you really have to identify the specific nerve on which the procedure was completed. This area can be pretty complex, so you got to read each and every detail of the operative note because it's a lot going on. All right, so as usual, we're at the end. And at the end, we did these things. We looked at terms, abbreviations, anatomy, procedures, blah, 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 blah. And I think I'll end how we started. Did I say this was my favorite type of music? No, I have others that I like as well. Not like us. They're not like us, all the other folks in healthcare. They're not like the coders.